Hello and welcome to my video. I want to talk about the bullying and mental health because lately I've been realizing through everything that a lot of my mental health problems were caused by bullying, and it really brought it back to me recently with there was a friend when my life started going to crap who I texted, reaching out because I needed somebody to talk to. I needed support because I was having a mental health breakdown. And her response was, I can't be your friend anymore and I can't support you anymore. So that was a very devastating blow. That was like the first one on top of hundreds of people that I used to be friends with that, one by one, they just couldn't, they decided they couldn't be my friend anymore. They couldn't support me anymore. So anyways, I, saw this person at Walmart and stuff about a month and a half ago. And, just that interaction, I, said, this is the finalization of this friendship. But, lo and behold, this friend the other day texted me and says that what I say hurts her, what I write in my blog hurts her, and it makes her upset. My blog is not meant to upset people. It's meant to, help someone. Maybe someday somebody will read and be like, hey, I relate to him, or this will help me get through this struggle that I'm going through. And, basically everything I say is based on what I went through and what I've experienced, with people that used to be my friends that, decided they couldn't be my friend. Unfortunately, I used to work in the healthcare industry, and almost all my friends were people that were in the healthcare industry. And, unfortunately, I realized that there's that stigmatization of mental health in the healthcare industry. And, I've done my research on it for, one of my classes in college. And, unfortunately, there's not the funding for mental health. A lot of mental healths are put in the worst part of hospital, the mental health in the world wards, and there's not the staffing for mental health. There's not the availability for mental health. I mean, I even experienced this when I was in the hospital and I was on the mental health unit, and throughout the day I only saw the psychiatrist maybe like a minute each day, which is horrible because you're in the mental health ward. You think that you're going to get to talk to the psychiatrist. You think you're going to be able to get the help that you need. And unfortunately, you're not able to get it because there's that stigmatization where hospitals are not putting the resources into mental health, and they're not making the availability for people with mental health. I remember when I went in to get the mental health problem, like I sat in the emergency room for 3 days, and I really basically didn't even have a nurse because I was just there waiting placement and stuff. And I remember before when I was trying to get mental health, they told me I'd sit on a med surg floor for 2 weeks. So there is that stigmatization where there's not the availability. But my stigmatization that I talk about in my blog that upset this person that used to be my friend was how a lot of my friends were nurses. And unfortunately, to me, a nurse, they should be caring. They should really, care about their patient, be compassionate, and all this other stuff. And, unfortunately, they were not that way towards me. And so I, wrote in my blog about how I feel like if they're not showing compassion for someone that they've known for so long, how can they possibly show compassion for someone that's going through a mental health struggle? That's their patient that they just met. And unfortunately, when I did work in the healthcare industry, I did have one nurse who told me that when I went for comfort from her and help, because I thought she was going to support me when I told her that I had a suicide attempt and that I was having a mental health crisis. Her response was, I'll teach you how to do it right next time so that way you're successful. And it makes me wonder, what if she could say this to someone that she's known for 8 years? What would stop her from saying it to a patient that she just met? So it just bothers me, and I just feel like, if they're not able to show compassion for me, then how can they show compassion for their patients? And unfortunately, this upset this person, and they're texted me the other day and said how I'm hurt them with what I write, how it upsets them, and then they took another step further and labeled me as being the psychotic person, and said, "Oh, here's the new suicide hotline. I think you should call it." No, just because I'm going through mental health, don't stereotype me. Don't be the typical, stereotypization of mental health by a healthcare worker because you're a healthcare worker. No, be the difference, change. That's why I want to so bad become a nurse. But I realize that's probably going to be taken away from me in a little over a week with the legal trouble that I'm in right now because of my mental health breakdown. But that's another whole nother story. Which, hey, let's go into it right now. How I was stigmatized by the health in the healthcare industry by my PCP when I went for mental health. There wasn't availability. I was been on a wait list now for almost a year and a half to get in to see a psychiatrist, to get a therapist with the actual hospital. I mean, I went away from the hospital setting and got a psychiatrist and a therapist, but unfortunately, I didn't realize there was other resources available besides the hospital setting. So I didn't get the help that I needed in time. And I kept telling my PCP that, I told him that I was awake for 130 hours. He said that was normal. No, it's not normal. And I had something more than depression, which he wouldn't even recognize my depression. He just kept telling me that I had adjustment disorder. I was unable to adjust with the events that were going on in my life. That was my only diagnosis. He told me I didn't have depression. He told me I didn't have anxiety. There was nothing wrong besides the adjustment disorder. Even when I went into the psych ward, they told me the same thing. Oh, you have adjustment disorder. You have no problems. You not sleeping is not a problem. You being awake for 130 hours is not a problem. You don't have depression. You don't have anxiety. You just have adjustment disorder. So unfortunately, I was stereotyped, given the wrong medications, which made me extremely manic, extremely unable to make decisions, make the proper, decision making, tell right and wrong. And now they say that I did something illegal, and I don't have any recollection of it, which is scary for one because of that, and sucks because now I know that my life's probably going to be over because of that the illegal stuff that's going on. But I hope that I can still make a difference. Hopefully I can make a change. Hopefully find a way to be a mental health advocate, make the change. Hopefully I can eventually build my blog, have a big following. Maybe my YouTube will take off. I don't know. But unfortunately, that's what I've been dealing with, and it's just bullying because I remember when workplace, if I talked to anyone, I said hi to anyone, I smiled to them. Didn't matter if it was female, male. I mean, it was worse when it was a female. I would constantly be told, "Oh, you're a flirt. Oh, you flirt with everyone. You hit on everyone." No, I'm just a generally nice person. Unfortunately, I, just let this bullying and bullying and bullying, more bullying get to me. And it changed the type of person I was because I remember before I started working in the healthcare industry, I was a different person. I could talk to anyone. I had people that wanted to hang out with me outside of the work, wanted to be my friends. You know, Unfortunately, I didn't really have that. I just was seen as this person with mental health that was an easy target for the bullies. And I look back on it, all the way through elementary school, bullied because of where I lived. And probably because I was an easy target, because it bothered me, because I had a mental health problem and I didn't realize it, because I was sexually abused as a youngster. Before I was even in elementary school, I was sexually abused. You know, performed my first oral sex on a female before I was even in elementary school. I see my first female genitalia before I was even in elementary school. Um, so it affects you, and I was just seen as this easy target, and I can remember, like I said in fifth grade in my previous video, I remember the teacher bullying me because I was an easy target. Middle school bullied because I was an easy target. High school I was bullied because I was an easy target because I didn't have the resources I needed. But I remember when I hit the college age and got a job, I was different. I could talk to anyone. Everyone wanted to hang out with me. I could, people were inviting me to hang out all the time. Um, So that bullying kind of stopped, but then I was still bullied because, I was an easy target back then. I remember the girl that I went out with that I worked with. She went out with me at first because she had this big joke with other coworkers, which is sad. And eventually that turned into a relationship for 3.5 years, and she stole my identity, got me in other legal trouble, which I finally got cleared up, and now I have all this other legal trouble. Um, that's besides the point. So and like it's just constantly seeing as this person, and then unfortunately when I did get into the healthcare industry working, the bullying just became even worse because people saw me as this easy target. They critiqued every interaction I had with anyone I smiled to, anyone I said hi to. They was constantly like, "Oh, you flirt with everyone, you ask everyone out, and all this other stuff." So then that just put me into this really bad mental state where I have so much social anxiety that I'm afraid to even talk to anyone. In school, I'm afraid to even answer a question if the teacher asks a question. I'm afraid to talk to any of my fellow classmates. And I feel like that's just because of the constant critique and judgment of being told, "Oh, you're a flirt just because you said hi to someone, because you smiled at them, or because you had an interaction with them." Um, and now I just feel like I'm this entirely different person than I was when I first had my first job and when I was in college the first time because, I could interact with anyone. Everyone wanted to hang out. People were inviting me out. And, I think it was just a different group of people that just weren't bullies that could see the true good in me. And now I need to find new friends that are like that. People that are going to be empathetic, people that are going to support me, people that aren't going to care about the legal trouble that's going on right now that I have no recollection of. Um, so like I said, unfortunately, right now in the healthcare industries, there is that stigmatization, and just in general, there is too, where there's not government funding. People are afraid to talk about their story because they're afraid they're going to be judged, afraid they're going to lose their job if they say they have a mental problem or they need some time off to deal with a mental illness. And then the resources just aren't there for people to get the help that they need, which is a sad, sad thing because mental health is just like any other disease. It's like cancer, that's a illness. But, there's all that funding for that. There's all the funding for COVID right now, but there's no funding for mental health because everyone's afraid to talk about mental health. So I hope that, through my videos, using this video and YouTube as a way to you know, get what's going on in my life, get my story out there, talk about things that I feel are important to talk about with mental health, with like the bullying because and just making sure that you're not being stigmatized by the men in the healthcare industry because when I was being stigmatized, I didn't realize it. I didn't know what was going on, but now like I've gained my education, gained my, research, I realize there's that stigmatization of mental health, even in the healthcare industry, where they're supposed to be helping you. No wonder people are afraid to get help. So, be the difference. Make sure you be your own advocate. Make sure that you advocate for yourself and be like, no, there is something wrong. There, I don't have social anxiety. No, I have something different. And when I finally did get a psychiatrist and get a therapist that actually listened to me, they realized that I wasn't, adjustment disorder. No, I have bipolar disorder. I have psychotic features. I do have depression. I do have anxiety. No, but no. The other previous doctors just kept giving me more medications, even though I kept telling them, it's making it worse. It's making it so I can't sleep. Um, so just be your own advocate. Don't be afraid to do the research. I hope this video helps save someone from going through something like I've gone through, where I was given so many medications that were incorrect for me that it made me so manic that I was unable to, make sound decisions, and I don't remember doing a lot of things that they say I did or saying things that I did. It's a scary situation. So, don't be afraid to talk about your mental health. Who cares if people stigmatize you? The way to help people is to get your story out there. So I'm going to get my story out there. I'm going to share my experiences and I'm going to share things that I'm passionate about with mental health. So thank you for watching this video. Please click the like button. Please subscribe to my video and please keep the comments positive, because I know that in my other YouTube videos that I created, people were always hatred, you talk, you sound gay, you're stupid, all this other shit. But, please be positive, and please thank you for watching the video, and please like my video, and please subscribe. Thank you.